Hi, anxiety. Now, one of the things about Innovate is we've been around a while, 20 years or more in various formats. So we have some insights into how things have changed over time. And one of the things that we've noticed is we get a lot more people and organizations wanting to talk to us about the challenge of anxiety, either for themselves or for the people who work for them. And so there's no doubt, in our view, that people's experience of anxiety is becoming more of an issue. Now, for some people, anxiety is a really serious and complex challenge that requires specialist input. But for most people, it's just something that pops up, usually at the worst possible time, and they wish they had more control over it. And that's an interesting phrase, because one of the things that makes people doubly anxious is the fear of being anxious and not being able to control it. So I'm going to share an idea and a tool or some tools with you. And I really like this way of looking at it because, well, firstly, it gives you an insight into what causes those symptoms. And then that leads on to the idea that you can get some control over it. So if I stuck an injection of adrenaline into you, you'd feel quite a few of the symptoms that you feel when you're anxious, your heart rate, all, these kind of things. And if I stuck a sedative into you, you'd feel the opposite. And one way to think about anxiety is that that's exactly what the body does to itself. Now, we can go into all the sympathetic and parasympathetic automated nervous system, but just think about it in the way I said. If you meet something or encounter something that is scary, then all these chemicals will kick off. But sometimes the chemicals will kick off just from you thinking about it. And sometimes with anxiety, they just kick off seemingly for no apparent reason. And if you think of it that way, then what you can think to yourself is, okay, so how do I kick the other chemicals off? And of course, there's plenty of ways. So some people will suggest breathing exercises. There's a course on that on our website. Some people would suggest a relaxation exercise. There's a course on that on our website. For some people, it's just talking to someone. It's just getting someone to make you laugh. For some people, it's having a massage. It's all kinds of things. So if you think about these anxiety symptoms as just chemicals that are firing at an inconvenient and unfortunate time, then what you can do is you can think, okay, I'm going to learn about myself and find all the things that I can do that will load those other more helpful and calming chemicals. Now, if you want a bit more information about it, then get in touch. But it's a really simple and actually not totally inaccurate picture of exactly what happens when you experience anxiety. Okay, grateful for your thoughts.